Thank you for coming.
You're welcome.
Yeah. I know you are physiotherapist, so how many cases do you need to do per day?
Usually we see around 16 patients per day.
Ah, wow. So usually do you need to have a conversation with your colleagues?
Yes, we do have a multidisciplinary team meeting every day. It's around half an hour.
Oh, okay. It's much more. So every day is a very busy, is it?
Yeah, it's a busy day.
Wow. So I know there are a lot of communication skills are required for communicating with your patients. So which one is the most important for you?
For communicating with the patients, I reckon building rapport is really important because building a relationship, a trusty relationship, is important for us to talk freely and also for the treatment to be effective.
Yeah, that's true, because sometimes if you do not trust that person, you don't want to give any information to her or to him.
Exactly.
Yeah. So, but sometimes you may hear some bad news from your patients. So how would you respond to it?
Usually, I reckon listen is the most important skills in responding to bad news. Usually, being sympathy and sympathizing them and also understand them, care about them. Just listen is enough.
Yeah, true. Sometimes I have some bad news, so that's why I need to find some friends to express my negative emotions.
Yeah, exactly.
Yeah. So you have to have a conversation with different area of health professionals, such as nurses and GPs.
Yep.
So which are the skills required for you to have a conversation with them?
Usually, the skill required for communicating with the nurses and doctors and other professionals would be being effective and simple, because they are seeing lots of patients every day. We usually just have a short window of communicating time for every patient on the ward.
True.
So we usually use lots of professional terms to make it simple and easy to understand.
Yeah, true. So for the professional terms, are they anatomy terms or
Yes.
physiology terms?
Yes,
Biological
yes.
terms?
Yeah, it's usually those terms we learn in the books, anatomy, physiology, or just some conditions, medical conditions terms that we use between us. Yeah.
So what advice would you give to a new graduate physiotherapist?
Yes, I reckon caring is a really important skills to have. No matter whether you're building rapport with the patients or the doctors and nurses, because that will make everything a lot smoother. When you have good rapport with the patients, the treatment will be more effective. When you have good rapport with the nurses, they will help you a lot more.
So you think building a teamwork or building a relationship with others is the most important thing, is it?
Yes, it is.
Oh, thank you. I've learned a lot from you.
You're welcome.